6 tonight, we're learning more about how much money Nashville General Hospital needs to stay afloat until the summer.
The Safety Net Hospital faces the threat of changing to an outpatient clinic. And as News Channel 5's Kyle Horan found out, even though that figure is in the millions, proponents of keeping the hospital open say they've already cut the budget.
I have here in my hands a request for supplemental funding of $19 million from the hospital to the city. And Metro really has the future of the hospital in their hands. They can either approve this amount of money, but council members say they have some questions.
You know, people go out of their way to help others at Christmas time.
If this joyous gathering,
And I hope people remember that Jesus is the reason for the season.
delivered more contrast
You have cheese? Yes, right down here.
to what's actually happening at Nashville General Hospital,
It's all what Christmas is about.
the mood might be different.
People with hypertension, diabetics, it's just a good fit for the community.
But ask Deborah Martin,
45 years ago, I gave birth to my child here.
who's been around long enough to see what's happening.
And actually, I worked here for a while. So I have had lots of experience here with Nashville General.
Hope for the hospital
I have David here.
is her Christmas wish.
I would love to see it stay a hospital. I know money is tight, but if possible, I would still love to see it.
The hospital has been facing an uphill battle. Year after year, they've required subsidies from the city.
Somebody wants this hospital to go away.
Mayor Megan Barry pushed back with a promise to change the hospital into an outpatient clinic. But people at the hospital say that's extreme, along with some community members.
It's unacceptable that the city cannot have a public-owned hospital.
Now hospital staff have released the numbers, answering questions from the council about why they need more money. The hospital says there was an increase of $1.7 million in patient revenue this year. Still, they say keeping the hospital running will be a team effort with the city. The hospital's numbers show what they say is a significant cost savings, something Martin says is essential.
If it closes, so much of an underserved population would be left with no place to go.
Kyle Horan, News Channel 5.
Because of their efforts, the hospital was able to lower their request for funding to about $13 million. But just last week, an audit released about the hospital stated management did not correctly monitor the finances of the hospital during the 2017 fiscal year. However, hospital administration disputes that audit, saying there was no financial mismanagement.